This is the video on how to send an attachment when submitting a claim in minutes. In this video, we will show the biller how to determine when an attachment is required, how to determine what documentation is needed, how to indicate that there is an attachment in the minutes claim screen, and how to fill out and submit the Administrative Uniformity Committee or AUC cover sheet that is required for all attachments in Minnesota. Let's learn more about sending attachments by opening the MHCP Billing Resources page on the Department of Human Services website. As we move down this page, we locate the heading Electronic Claim Attachments and a link for the requirements for electronic claim attachments. This section lists the various scenarios when an attachment is needed, as well as the required documentation for each instance. In this video, we are submitting a professional claim as a provider for a charge that is over a year old, which is the second scenario listed in this section. We click the plus sign next to this scenario to read more about the required documentation needed when we submit this claim. MHCP only accepts claims that are over a year old for the following reasons: member eligibility, MHCP denied the claim in error, and a third-party insurer or Medicare adjusted the payment. In our example, a member is requesting reimbursement from us for a claim that they had to pay out of pocket a year prior due to ineligibility. The county has since corrected the member's eligibility, and they have provided us with a letter stating that the member was eligible during that time period. We need to fax this letter as an attachment when we submit our claim. We will demonstrate what to enter on the claim information screen. We start by logging into our Minutes account and selecting the 837P professional claim. We will complete the initial screens as we would for any other claim. On the claim information screen, we will complete the fields in the claim information section, and then we will select situational claim information to expand this section. In this section, there are two fields that we must complete to indicate that there is an attachment for this claim. We find these fields located under the heading Attachments. The first field is the attachment control number. The control number is a unique number created by the provider. It can consist of letters or numbers and can be up to 50 characters long. This control number is also entered on our AUC fax cover sheet and is used to identify the attachment for the claim, so it is important that they match. We will make a note of our control number so we have it available when we fill out our AUC cover sheet. The second field is Type. This is a drop-down field with multiple options. We are providing documentation for a claim, so we will choose OZ-Support Data for Claim. Once we have entered the required information, we click the Add button to add it to our claim. The information we entered is displayed in a table in this section. Once we have completed those two required fields, we can select Continue to complete and submit our claim. After we submit our claim, the submission response screen displays the message that the claim has been submitted for processing. On the right navigation panel, under Related Links, is a link titled Electronic Claim Attachments. We click on this link. This brings us back to the Electronic Claim Attachments page on the DHS website, which we reviewed at the beginning of this video. To send our letter from the county, we need to complete an AUC cover sheet, so we select the link AUC cover sheet for healthcare claims. This will open the AUC Forms page. This page contains a number of forms and other instructions. We need an AUC cover sheet, so we locate Claims Attachment Cover Sheet on the list and click the arrow to the right of this heading to expand this section. This section contains 3 items: the Claims Attachment Cover Sheet, instructions, and the AUC payer contact information. We will select the link for the Claims Attachment Cover Sheet. This opens the AUC cover sheet for healthcare claim attachments. This document contains drop-down lists and fillable fields, as well as instructions for sending an attachment. Follow along as we complete the AUC cover sheet for our documentation. We start at the top of the page next to the To field. We click on the Select Fax Number field to display the drop-down list and select Minnesota Department of Human Services as the payer. If we were sending this fax to someone who was not on this list, we would enter their information in the Other Fax Number field. Next, we enter the attachment control number. Remember, this is the unique number that we created and entered on our minutes claim. We enter our National Provider Identifier, or NPI, or Unique Minnesota Provider Identifier, or UMPI, in the Billing Provider ID number field. This must be the same Pay-to NPI or UMPI as on our minutes claim. We enter the billing provider name that is associated with the NPI or UMPI. For the patient ID, we enter the MHCP member number for the person who receives services. We enter their last name, first name, and middle name or initial in the patient name field. The field titled Property and Casualty Claim Number is not used by MHCP, so we will leave it blank. For attachment send date, we will enter the date that we are faxing the attachment. Providers must send the attachment by the end of the next business day after submitting the electronic claim. MHCP will deny claims that do not include an attachment by the end of the next business day. We enter in the total number of pages, including the fax cover sheet. Last, we will enter the contact name and phone number for the person sending the fax in the contact name/phone number field. Once we have completed our fax cover sheet, we will print it and fax it along with the letter from the county. When we submit a claim with an attachment, our claim will automatically suspend. This means that a claims specialist must view the claim and ensure that the required documentation is correct before it is processed. The Department of Human Services offers various training opportunities, including other on-demand videos and online sessions. You can register for the online sessions by visiting the MHCP Enrolled Provider Training page on the DHS Provider website. Check the MHCP Provider News and Updates for announcements on changes to programs and information about new learning tutorials when they become available. Thank you.